She's an emergency immunisation officer at the World Health Organization. Really good to have you with us. Firstly, tell us more about this vaccination campaign. How successful do you think will it be?
Yeah, we're really excited about it. And, thanks again for having me. This is the very first preventative Ebola vaccination campaign that's been launched nationally on the continent. So we're really excited. Sierra Leone, as you mentioned, lost 7% of their workforce. And so we hope that this campaign will be protective against any future outbreak that should occur and prevent an outbreak from exploding, because our healthcare workers are really our first line of defense.
Well, that's right, because a big part of this vaccination campaign is to essentially prevent history from repeating itself, because we know that the continent of Africa has been subject to several Ebola outbreaks that have been thwarted to a certain extent, but never completely. So how hopeful are you that what we're seeing in Sierra Leone can be repeated in other parts of the continent where Ebola has been a problem?
Yeah, so we hope to repeat this in other countries. Due to supply constraints over the last few years, the vaccine has been previously used only for outbreak response. Now countries have the opportunity to apply for vaccine doses and funding to vaccinate the health workforce preventatively. So we hope that this serves as an opportunity for other countries to see the success that Sierra Leone brings, and other countries will follow in the same suit.
And this campaign that we're seeing unfold in Sierra Leone is largely thanks to vaccines and funding provided by Gavi, the Global Vaccine Alliance. We know that vaccine manufacturers in particular have been accused of essentially withholding these essential supplies from the continent because of the high price points of these vaccines. Are you confident that we're finally turning the page on this, that Africa will be receiving the vaccines it needs, not only for Ebola, but for other diseases that can be prevented?
I think that is a case-by-case basis, but I think that for Ebola, all Ebola at-risk countries have access to now apply for this vaccine and funding that comes along with it. We are prioritizing those countries that have already had an Ebola outbreak, like Sierra Leone. But all of those countries, as I mentioned, have the ability to now access the vaccine free of cost through the generous support from Gavi, the Vaccine Alliance.
Yes, it really is a welcome development, and we wish you and your partners all the best in this crucial campaign. Reena, Doshi, thanks so much again for joining us on the program.